Ohio prison worker has already died of COVID-19. As of yesterday, 100 had tested positive. At the same time, a union representing prison workers has said its members are not receiving needed masks and are concerned that workers are not eligible for the paid sick leave they need during this crisis, and they're not receiving hazard pay. If we want to save lives and make sure a prison sentence is not a death sentence, Governor DeWine has to begin safely and responsibly releasing many more incarcerated people. It's also important that ODRC provide quality medical care to make sure the sick are monitored and have access to the needed care with a clear protocol for that care in prison as well as transfer to hospitals. This approach will protect incarcerated Ohioans, prison workers, and the broader community. One of the important points that we want to make and to raise up here is that this crisis is really laying bare the inequities and injustices that already exist in our society. And the criminal justice system is a clear example of that. And that's what we're going to be talking about today. So on today's call, you'll hear from some individuals who are directly impacted because people they love are in prison as the virus spreads behind bars. Also on the call are policy experts and advocates who have been working nonstop on this issue. Everybody's going to make a short statement, and again, there will be time for questions at the end. I will also share on the chat a link for the Ohio Organizing Collaboratives continuing to collect stories and to share stories back out to the public from people who are directly impacted. So first, I want to introduce Kevin Ballou. He's a formerly incarcerated Clevelander who has close contact with friends behind bars. Kevin?
Thank you. Thank you, Pete. So my name is Kevin Ballou. I spent 5 years at Marion Correctional, and so I understand what works and what doesn't work, and I understand directly what they're going through inside. I've been home about 2 years, and since then, I'm a student at Cleveland State. I'm a organizer here in Cleveland and an artist as well. But I still have a lot of loved ones who are still at Marion Correctional and throughout the ODRC system. In particular, I've been in contact with some people at Marion's minimum security camp, and I'm thinking about some friends of mine, Michael Powell and DeAndre Gaston. And so Michael Powell, for instance, he has served 10 years on a 20-year sentence. He has been identified by the institution as nonviolent and low risk. He's at a minimum security camp. He's a leader throughout the institution. He's taught everything from improv and theater classes to classes that mentor younger residents in the institution. So before the outbreak of COVID-19, Michael's co-defendant was released by the judge, and Michael filed the early release, but because of this outbreak, his judicial release has been put on the back burner, even though he was so close to coming home. And there are plenty just like him who are in this same situation. And even at the institution right now, they're on total lockdown. They can't go outside at all to even social distance. They can't use the library. They've been limited to sometimes 1 or 2 hot meals a day that are separated by hours of not eating. And they can't and haven't been to commissary in over a month. So they don't even have access to other food or the proper hygiene they need to keep sanitary. So I'm thinking that in order to relieve this dilemma, we could start adhering to some of these judicial releases that are on file and let some people go. I know people like Michael, people like myself. We're examples of how the system has built empathy, how the system has worked, and focusing on creativity and community has helped people grow, and these people are ready to come home and be leaders. I'm also very worried about the people, the prison's ability to take care of people that are diagnosed with a serious condition of COVID-19. I'm pleading that Governor DeWine make sure that incarcerated Ohioans who get sick with the disease can go to an outside facility and get the proper care that they need, just because the facilities are not equipped with the proper care, and they can't provide that. So please, Governor DeWine, make sure that they're treated fairly, treated at an outside facility, and let's bring some people like Michael Powell and like DeAndre Gaston home. He has the power, and I'm asking Governor DeWine to use it.
Thank you.
Thank you.
Thank you, Kevin. Thank you so much for sharing that story. Next, we have Kwanzaa Maxwell from Columbus, Ohio, whose father is incarcerated at Noble Correctional Institute.
Hi, my name is Kwanzaa Maxwell, and I'm here to talk about my dad, David Watkins. My dad is a family man. He has 6 children. He has a wife. He has 15 grandchildren. He enjoys taking family vacations. He enjoys mentoring the youth through basketball organizations and coaching. He never misses a game. Right now, my dad is serving his sentence at Noble Correctional Facility for nonviolent crime. My dad is an insulin-dependent diabetic and a kidney recipient. He takes a number of medications to stay alive on a daily basis, 2 of which suppresses his immune system, which unfortunately makes him at greater risk of contacting the COVID-19 virus. He's at a facility who houses their inmates in an open dorm-style room with bunks very close to each other. He goes and eats at a cafeteria with benches and inmates just at an elbow's length away, which makes it impossible to practice social distancing and to protect themselves. My father is a good man. He's a good father, great husband. He has a great support system. He's tremendously loved. He has a successful business out here. And his immediate release is crucial to his survival and his right to spend the rest of his natural life here on earth. He was not sentenced to death, therefore he does not deserve to die while serving his sentence. That's why I'm calling on Governor DeWine to do the right thing, the most humane thing, and that is to bring my dad home today.
Thank you so much, Kwanzaa, for sharing your story. Next, we have Rosie Pollock, whose husband is at Pickaway.
Hi, my name is Rosie Pollock. I'm a frontline worker. I go to work every day to ensure that your loved ones are taken care of. I am here pleading with Governor DeWine to please take care of mine. My husband is incarcerated at Pickaway Correctional Institute in an open dorm where cases just keep popping up. If we're all in this together, it's time that we need to all stand together. We need Governor DeWine to please hear our pleas and help us to release more than 100 and some inmates for their safety, for everyone's safety. I'm not asking for him to get a free ride by any means. He can do house arrest. He can do anything like that, strict probation, anything. I'm just asking, when he went to prison, there was no virus. He was not sentenced to death. I'm just asking that Governor DeWine hear our pleas and help us to free our loved ones. If, God forbid, he does get this virus, I would rather him be here so we can fight it together rather than him be alone. Thank you for your time.
Thank you, Rosie. And thank you again to all 3 of you for having the courage to share these stories. It's really hard to hear what's happening in this moment. And for those of us who are working, on advocating for a better approach, it's even for us, it's good to be reminded again about what it really means at the human level. And that's one of the things about this call. We have the opportunity to share these stories, which I know are very important to humanize what's happening, but also to be able to advocate for solutions. And so next we have Gary Daniels, the chief lobbyist with the ACLU of Ohio, and he's going.
Thank you, Pete, and thank you to everybody who's tuning in and watching today on this critically important issue. What we have here in Ohio is no less than a human rights crisis unfolding before our very eyes. We know, and as you've heard, mass incarceration is 100% incompatible with COVID-19. And this is not just our prisons, this is our jails, this is where immigrants are detained, these are our youth facilities, these are our halfway houses, and so much more. This all applies to each and every one of those entities, particularly our prisons, at least for right now. Because Pete had shared with you earlier some of the startling numbers that have come out of our prison system with regard to those who are infected, including the staff, and how much those numbers increase on a literally daily basis. The ACLU of Ohio, we knew that trouble was coming with COVID-19 because we do so much work with prisons and jails, and we knew what the ramifications roughly were going to be. That's why we had immediately set up COVID-19 at acluohio.org. That's an email hotline where people can write us about what's happening with their loved ones inside. We then use that information to shape our advocacy and do other things in regards to these issues. And we've had well over 100 people reply to that in the roughly 3 weeks since that has been set up. What the ACLU of Ohio specifically wants from the governor at this point is to use his broad executive authorities to address this issue. 205 people recommended for release isn't nearly enough. Whether you agree with the governor or not, what we have seen up to this point is him use his executive powers to close down businesses and private entities, to restrict our personal movement outside on the streets and in our neighborhoods, and even at one point to move an election. We think he can use these broad executive powers to decarcerate our prisons and jails and other facilities, and that he needs to do this much quicker than he is currently doing. Keep in mind, too, that the state of Ohio doesn't have just one prison problem. It has at least 25 when you multiply that across how many institutions there are. We are currently over, or about 10,000 over capacity in our prison system. And so when you talk about some of the things the ACLU of Ohio would like to see, we are talking about decarcerating our prison system by thousands upon thousands of people to effectively deal with COVID-19 behind bars. That 10,000 above capacity should only be the start. We've got numerous other categories of people who are worthy of release, who can be safely released to hopefully deal with COVID-19 behind bars. And I want to add one other thing too. We're not talking about just throwing the doors open and people come outside. Re-entry is obviously a very important aspect of this. We don't want people who are vulnerable inside coming outside to similar vulnerable situations where they could be getting other people sick. And we don't want people who are outside getting sick from people coming from prisons and jails. So we will need some creativity, some flexibility with regard to re-entry. It would be temporary in nature, but these are the types of things that Ohio needs to look at. The governor surely knows that thousands more people need to get out of prison to deal with this effectively. We just need the governor to do it, and every single day literally counts. Thank you.
Thank you so much, Gary, for sharing that. ACLU has certainly been a leader over the past month and before that as well on this issue. So appreciate your insight. Next up is Kenza Kamal. She is the policy director at the Juvenile Justice Coalition. Kenza?
Hi all. My name is Kenza Kamal and I'm the policy director at the Juvenile Justice Coalition. As others have said, this pandemic has made it very, very clear that we are only as healthy as each other. And in understanding that, one of the first things that the governor did, and one of the reasons that Ohio is considered a national leader right now, was to close schools to protect children and families. But now Ohio must do the same for the hundreds of kids who are under the supervision of juvenile justice systems across our state. I want to point out two things about the kids who are in our juvenile justice system. For one, in Ohio, Black children are committed to juvenile facilities at 5 times the rate of white children. That means that the kids that are staying locked up and being wrongly left behind in this moment are disproportionately Black children. Second, kids in the juvenile system have higher rates of health issues than the general population of kids, including asthma and hypertension, which are two of the conditions that make you too susceptible to the coronavirus. So while in previous circumstances, this health disparity was worrying, right now it is deadly. So what we need to do is get kids out of these conditions. Continuing to detain them runs the risk of facilities choosing to keep children in long-term isolation, which can become de facto solitary confinement, which I hardly need to say is extremely and uniquely harmful to children and their brain development. The Department of Youth Services has already changed some of their policies in reaction to the virus, but there is much more that needs to be done. The governor and DYS should also encourage and work with all 88 counties to send kids home. And there are multiple categories of kids that should be prioritized and sent home first, to stop new children from entering the facilities and to waive fines and fees in the meantime, since in a time of isolation and major economic hardship for many of these kids and families, kids support systems should not at all be made to pay in order to communicate with them. At the end of the day, our kids should not be incarcerated. They should live in well-resourced communities. And we can't leave behind hundreds of our kids who we committed to protect in circumstances that actually promote rather than reduce exposure and contagion. But we can prevent sickness or death in our youth facilities if Ohio acts now. Thank you.
Thank you so much, Kenza, for your words on that. It's good to hear the youth perspective on this, and it's hugely important. Next up, we have Carter Stewart, who's a former U.S. attorney, and he's with the Law Enforcement Active Action Partnership. Carter.
Hello, my name is Carter Stewart. As Pete just said, I'm a former U.S. attorney for the Southern District of Ohio, and I am a member of the Law Enforcement Action Partnership, which is a nonprofit organization comprised of police, prosecutors, judges, corrections officials, and other law enforcement officials advocating for criminal justice and drug policy reforms that will make our communities safer. To me, this is a public safety issue. Law enforcement personnel who work at the state prisons are putting themselves, their families, and their communities at risk. Every day that they go to work and return home is another day that they're rolling the dice as to whether they will spread the infection. The more staff that get sick, the less capable prison leadership becomes in terms of running and managing the prisons. This is in addition to the fact that many of those who are incarcerated will be released back to their communities, risking additional, unnecessary, and preventable deaths. It's also a public safety issue because most, if not all, rehabilitation programs have ended. Prison visits have been suspended. So thousands of people are locked up without meaningful rehabilitation services or meaningful contact with family members. This is a recipe for disaster, both in terms of recidivism rates and prison safety. Governor DeWine has been a true leader on the virus in so many respects. I hope that he will be one on the prison issue as well. It would also help for him to provide clarity to the process so that if he can't issue release orders for all relevant prisoners, he can tell families where to go to seek them, whether the courts or the prosecutor's offices, because right now many families are running back and forth trying to find out where the pressure points are for them to seek release of their loved ones.
Okay, thank you so much, Carter, for sharing your perspective. I mean, it's really good to hear the perspective from law enforcement side. It's really important. Next, we have Blythe Barno from Faith in Public Life. Blythe?
Hello, everyone. My name is Blythe Barno with Faith in Public Life here in Ohio. Faith in Public Life is a national network of nearly 50,000 clergy and faith leaders who are united in the prophetic pursuit of justice and the common good. As people of faith, we observe the sacred holidays of Baiseki, Passover, Easter, and soon Ramadan with heavy hearts as the coronavirus pandemic spreads. Each of these holidays celebrates community, renewal, service, and liberation from oppression. The coronavirus pandemic reminds us of the essential truth that all of our lives are interconnected. The health of the community and the nation depend on our acceptance of the moral responsibility to love all of our neighbors, including those who are incarcerated. So in this holy and heavy season, we as people of faith call on Governor DeWine to protect life and practice love of neighbor by dramatically reducing the number of Ohioans who are incarcerated and freeing as many people as possible, whether they be in prison, jail, youth facilities, halfway houses, or immigration detention facilities. As a Christian, I'm reminded on this Easter Monday that Easter is not simply a day. It is an order of life. Governor DeWine, as Christians, we are called to be an Easter people in a Good Friday world. Every day we are called to speak life into people and not death. In his Easter address yesterday, Pope Francis reminded us that, quote, many have used warlike metaphors to refer to the pandemic we are experiencing. If the struggle against COVID-19 is a war, then you truly are an invisible army fighting the most dangerous trenches, an army whose only weapons are solidarity, hope, and community spirit, all revitalizing at a time when no one can save themselves alone, end quote. Governor, the beloved children of God who are incarcerated in Ohio cannot save themselves alone. They need you. This decision is in your hands. As people of faith, we join in solidarity and call on you to meet the moral challenge of this catastrophic moment. There is no time for half measures. You must act boldly and now. It is the right thing to do, the just thing to do, and the faithful thing to do.
Thank you, Blythe. So I'm starting to get some questions through the chat. So that's